Live on Your Health tonight, an urgent effort to get more Americans vaccinated before Halloween. Here to explain is Dr. Rick Malley, an infectious disease specialist at Boston Children's Hospital. Nice to see you, Doctor.
Hey, Dr. Malley, it's great to see you. Thanks for your time. So, the CDC says it's focusing on at least 3 respiratory illnesses this fall, and of course it includes COVID-19, influenza, and RSV. If I could ask you, if there is one, which one do you worry most about for kids?
I mean, in general, for kids, both RSV and influenza can be very dangerous. RSV, especially for young children, and also for children who have either cardiac or lung disease, RSV can be particularly dangerous. So those would be the 2 that we would focus on the most, although, of course, as we know, COVID can sometimes be dangerous in children as well.
So health officials in some states, Doctor, are saying that they plan to promote a new strategy, and it's called Flu Before Boo. What does that mean?
You know, I think it's a very cute and clever way to remind people that Halloween is a pretty good time to make sure that your family, your loved ones, and yourselves are all vaccinated against many of these respiratory viruses, because it's around November that we start seeing an uptick in most of those viruses, and we expect that the same will be true this year.
Oh, I get it. Flu before boo.
Right.
Oh,
I should have said it. I didn't say it right.
And as you know, there are vaccines available to protect many children from COVID, flu, and RSV. Here we are, where are we? We're in the middle of August. When should parents start thinking about that?
Well, you know, so it's important to realize there's really 3 different issues. One of them is the flu vaccine, which I think many parents have known that their children should receive the flu vaccine as long as they're older than 6 months of age and there's no contraindications. And that really should be done probably before Halloween. The COVID vaccine, we're sort of waiting to hear a little bit about the sort of updated versions that will be coming out probably this fall. And I think your viewers should stay tuned for more information from their healthcare providers. And then for RSV, this is a very recent development. It's actually a monoclonal antibody that has been recently approved and that we are all very excited to see implemented. And that is really something that the CDC is recommending for any child under the age of 8 months, because that's really the peak period in life where RSV in childhood can be extremely dangerous.
Dr. Malley, thank you so much for taking the time. As always, we appreciate you.
Great to see you, Dr. Malley.